My name is Scot Ackerman, and I'm a radiation oncologist here in Jacksonville, Florida. In my practice of oncology, I see lots of patients with cancer, and we have different ways of treating these patients with cancer. We have beam radiation, and we have brachytherapy, all sorts of things like that. And one interesting advance we have is what's called stereotactic radiosurgery, SRS. And stereotactic radiosurgery is surgery but with radiation. There's no scalpel, no one's getting put under anesthesia, no one's getting cut open. It's using radiation in a very precise way to surgically eliminate, if you will, surgically resect a tumor deep in the body. It was originally developed and designed for brain tumors that were unresectable, that were deep in the brain. And this, what it does is it allows us to give a very, very high dose of radiation to a very small lesion deep in the brain. And that high dose of radiation in 1 or 2 or 3 fractions or treatments is so high that all the tissues that we hit deep in the brain there, that small volume of tissue, gets eradicated. And we're able to give the radiation dose in a very high dose to a very small area and virtually no radiation to anywhere else in the brain that's not that little spot that we're trying to hit, the little BB, if you will, or that little centimeter lesion that's deep in the brain. With recent advances, we're now able to do this in other parts of the body as well, for small lung cancers, for small liver lesions as well, and for tumors on the spine also. It's called stereotactic radiosurgery. You may have heard of CyberKnife and Gamma Knife and those sort of things. They're the same thing. They're all types of different ways of delivering stereotactic radiosurgery.
For more information on this type of cancer or any other cancers, please call Dr. Scot Ackerman at First Coast Oncology, 904-880-5522, or visit us on the web at www.firstcoastoncology.com.